Yes.
Yeah, it's very
Help me.
good. You
If that
see?
is what I gave to you, you would have been okay.
Yeah, well, listen. Yeah, I know. Okay. እዚህ ያላችሁ ሰዎች ወረፋ ምትቆያሉ ብሮስ አትገባትም ነው So this is medicine. What we have provide there is a lot also downstairs. So
All the antibiotics.
yeah, antibiotics, everything. So if anyone really if anyone needs some kind of medicine.
በጣም ስለታመን ያስገባው እኮ ታሞ ነው መሰለኝ
ቶሎ ቶሎ ወዚህ ጋር ይሁን ምክንያቱም ትራንስሌት የሚያደርግልት ይፈልጋል ግን ቶሎ ቶሎ እንዲያደርግ ብዙ ሰው ስለሚኖር
So you're not the doctor, right?
Yeah, he's a doctor.
Yeah, but I see this, if the staff could translate. You understand?
Yeah.
If the he's too busy. You know, yeah, so some staff.
ሌላ ትራንስሌተር እናንጣለን
That's gonna slow him down.
ሰው እዚሁ አንድ ክፍል ይሁኑ ወይስ ሌላ ክፍል እሷ ትንት ኦኬ ሹል ሄልፕ አንድ ወንበር አምጪለት What is Bruce? This is the main doctor. His name is Getachew. Nice to meet you. Yeah. And Tom. Yeah, there's some patients. So she's a nurse. So we'll see how they. So Pastor Vicky will sit here. Okay. And then we'll bring. You can put that medicine. And the medicine will be. I have some. No. እሱ ያመጣው
I have some antifungal cream and some ibuprofen. Just little tubes of antifungal cream and ibuprofen. And I have some, if we can flush ears with this, maybe a big syringe. And I have some alcohol pads and some gloves. I just brought a few things. Okay, good. Okay, good. Yeah, I have 750 pills, so I have a little bit. Good, good.
It's pretty dark. We'll find out if we're gonna be.
ከኛው ክፍል ምንድን ነው የሚደረገው?
ላቦራቶሪ ክፍል ነው ይላኛው ሌላኛው ላቦራቶሪ ነው ወደዚህ ያሉ ማለት ነው
I see. Did he have an injury? What kind of an needle? Here.
over here
What did he poke with?
needle
Just a needle. Why did he do sharp needle?
Yeah.
By accident he was just And it's been this way for 3 months. Yeah, debrided a little bit. Yeah. Yeah, so we can we clean them up and do that here?
Yeah, you can do that.
Okay, I can do that. Do we have something for a dressing for
Okay,
him?
actually there are as a member or they can do it here.
They can do it
The
here.
other staffs can do it here.
So you have somebody can do the dressing?
Yeah.
Okay. Yeah, and we should get him some, do we have doxycycline or some sort of
Yeah.
cephalexin? Dicloxacillin, you have that? Can you ask him if does he feel that the same?
Yeah,
You feel this the same?
ሁለቱን እንዲሲያደርግ ስሜቱ ተመሳሳይ ነው ወይ ሲነካ ይሄኛው ይሰማል ይሄ ይሰማል
Not so much there.
ያ
What happened? Yesterday, there was firing by some kind of food in that oils come to him. It's burned yesterday. ማነው ስሙ? አሁን ምንድን ነው የምታደርጉለት እናንተ? ወደ ጎንደር ይላክ ነው ሳላችሁ መድኃኒት ለዚህ ነው አለ እሺ እናንተስ አንድ ሰሞኑ ነው? ኦኬ መቼ ነው የጀመረው? አዲስ ነው? እንደዚህ እያደረጋችሁ
ትራንስሌሽን ተቸገረ ትንሽና
እኛ ብናግዘው ሲኔ ባለቤት ብታግዘው
እንደዛ ከሆነ ደስ ይለናል። ሌላ ባይክ
ያግዛቸዋል አይደል? ሌላ አንዱ በርና
በቃ እንደዛ ብቻ ነው።
ህይወት አንዱ ዩኒቨርሲቲ አግልን ፓስተር ቢክና ዶክተር ብሎ አንድ ላይ ነው።
I'm sorry. Okay, well, we can treat her. We can do the omeprazole BID again. Yeah, we can treat that. She doesn't have any crackles. She doesn't have any murmur, and she's got no swelling. So I don't think I'd want to mess with any digoxin or anything. She can stay with that. But let's treat her. Yeah.
Okay.
What is her condition?
She's got some gastroesophageal reflux, and she has a history of congestive heart failure. Accessibility to medicine, follow-up care. We can basically, we're pretty much limited to acute things, but follow-up care is probably a big one. But although he tells me that they could see that someone in a hospital, which I would hope that could happen in the future, but we're of course not sure. Yeah, but it's surprising they have quite a few things here. I made a suggestion, and they've been able to fill every single thing, so it's been great. Yeah.
ምንድን ነው በሽታ? ስንት ጊዜ ነው ከጀመረ? ስም ማን ነው? እያዩ ማን? ከየት ነው የምትኖረው? His name is Iyayu Tagga. He lives in France, and the last 2 years he has a lot of problem. Whenever he eats, there is vomiting and also diarrhea, and there is also burning inside, and there is some coughing sometimes. So he's really struggling. So he tried a lot, but they refer him to the big hospital, but he doesn't have any means to go there. So he's asking us, please help us to refer me to the better one. I am struggling a lot. I am suffering a lot. That's what he said. And so what we have to do now, we will send him to Pastor Rick. He will see him and see how the doctors recommended. If they recommended there, and then if there's any means we can help him.
Okay, when he does that, we want to get that camera. When he's talking
when you go to his pastor,
when he talks to camera, we
Yeah.
want to get that.
Yeah, we will do that. Okay. ታዲያ እንዴት ሰላም ደህና ነህ? ታዲያ አለን እያያችሁ ነው። እሺ ምንድን ነው የእሱ ችግር?
ስፕሊኖሜጋሊ የሚባለው የጣፊያ ማለት በአማርኛ በእንግሊዝኛ ኢዝ ኢንላርጅመንት ኦፍ ስፕሊን።
ስንት ጊዜ ነው ከተጀመረ?
ስንት ጊዜ ነው አለ?
3 ዓመት ነው ለመመርመር አልወሰንም።
3 years
ቴል ዘመን
አሁን ይሄ ቆሰለ ገበቴ የሽንገለ በቃ ውጋት ነው። በዚህ አንቀሳቅስ የሚያህል በብቻ ይስማማል።
He has chronic abdominal discomfort, which is associated with huge splenomegaly. It is splenomegaly is secondary to malaria infestation. Malaria is common in this around in France. He was treated for malaria.
ሁሌ በቃ ክሮኒክ በስከብር በቃ ድን ያዝም ማለት ነው። ሳባዲ ጀኖን ጃን የተሻለ ጥቂት
No.
ከዚያው ጉብሬ በተይ ላይ ወርድ
He tried the last 3 years. He tried every clinic, but still that problem is still here.
So what's the next thing to do?
We don't know. ምንድን ነው አንተ ሪኮማንድ የምታደርገው?
Prolonged treatment of the anti-malaria drug. Chloroquine. More than 2 or 3 months you will take it. And it will be subside.
Yeah.
So what can you do for him today?
We will prescribe for him anti-malaria drug. Chloroquine to tab daily for 2 months, and maybe he will develop anemia, and she plan to prescribe some iron, supplement irons.
So was this problem caused by bad water?
Not it's secondary to malaria.
Okay, so
ከውሃ ጋር የተያዘ ነው።
so how
No,
what
this
was
is
the prevent?
hemoparasite.
So he has parasite
Yeah.
from
The blood. So
እንዴት ከየት መጣ ነው? ላይ ፓራሳይቱ ከንጹህ ውሃ ባለመጠጣት ነው።
parasites divided into two. It's intestinal parasite and hem parasite.
Yeah.
The parasites living in the bloodstream. It is secondary to malaria. Do you know malaria?
Yeah.
Malaria causes some red blood cell destruction, and that causes this spleen is responded to the destruction of the red blood cells, and it becomes huge. It leads maybe some anemia, lack of red blood cell in the bloodstream.
Do you think 2 months of the medicine will cure that?
Yeah, but it may be a relapse again. If another attack is occurred,
Right.
it may be a relapse.
So what is the best way really to cure for him?
Curative is possible, but when the attack comes, it becomes enlarged.
So he doesn't have resist really to fight, the virus inside his body.
The parasite.
Yeah.
The parasite, he may live outside this area to be cured.
Okay.
so he's in a bad environment.
Yes.
Environment is dangerous
Yeah.
because he's susceptible for
Yeah,
more.
he's susceptible to that malaria. It is common here. If we treat it,
We're kind of looking for long-term solutions to
Solutions.
these problems.
giving the anti-malaria drug.
Okay.
Okay.
I know that and I like lot ማለት ቪዥን ቦታ
Does she get discharge in the morning? She has to wipe some things out of her eyes? Okay, so her headaches, her eyes, and her stomach.
No, her body.
Her left side of her body. Okay.
And sometimes she gets swollen up, her body swollen up.
Swollen up.
Yeah. She's taking medicine for blood pressure.
Yeah, that's
Yeah, listen it back.
does he get thrown up?
Tell her to take a big breath.
በጣም ይጠብሳል ወደ ውስጥ እንደገና
Okay, that's good. She can breathe regular. Just know.
አሁን ምንም ማለት ዝም ብሎ ይጠብስ
Okay, is she hurting here? And on which side? Right here, huh? Yeah, okay, sorry. How about here?
ዛሬ ያሞታል
ትችላለህ አንተ ታግዘዋለህ። እናንተ እሱ ላይ በደንብ አስተባብሩልን። እሺ ሰዎችን ወደ ሕክምና የሚሄዱ ወደ ላቦራቶሪ የሚሄዱትን ወደ ላቦራቶሪ
Pass me that. Just that black case right there. Thank you. That's fine. Check your eyes.
Did you bring the glove, yeah?
I've got gloves.
So you do need it? Or?
I really should be. We just started so quick, but I'll get some. Yeah, I should get some really. Let's give her some ibuprofen. Yeah, she can take 400 milligrams, TID. Have her take it with a little bit of food. And that'll help her headache. Her pain is muscular. It's in her muscles. That's where her pain is. So let's have her do that, and she needs to take that with drink lots of water during the day. She's a little bit dehydrated. Okay?
Two times, right?
3 times. DID. DID is twice a day. Yeah.
Someone like that was?
Yeah, and the medicine ሰጠዋቸው ኢንስትራክሽን እንደሚወሰድ ሳይሰጧቸው ቀርተው ማለት ነው። እኔ እንደሚወሰድ medicine
በቃ ይሄን ተስተናግዳ
She traveled a lot. She came and then she fell here. Her breast, I think the breast cancer. She has a lot of fever. And she's sleeping almost waiting here 4 hours. She came early in the morning.
Came early in the morning?
Yeah, she fell. How
far did she come?
I think she told me that 5 hours. She
Walked 5 hours.
Now she's inside.
Tim.
Hmm?
Yes. Walked 5 hours.
Now she's inside.
Tim.
Hmm?
Yes.
መቼ ነው የጀመረሽ? አንተ ምን ባሏ ነው? የት ነው የምትኖሩት? አንቺስ? ምን ያህል ሩቅ ነው ከዚህ? በእግርሽ ነው የመጣሽ? ሩቅ ነው። በእግር ስንት ሰዓት ይወስዳል? Wow. Her village is by walk 10 hours, walking 10 hours. But she says that she gets someone help her to come here with halfway to a car. So she's struggling, so she doesn't have any. Starting 2 months, the last 2 months, so she can't eat, she can't sleep, there's a lot of pain. So that's one of the things. አንተ ሴት ነው የምትኖረው?
እዚህ አቀበለ ነው።
ምንድነው ያመመህ አንተ?
ዶጋት እዚህ ወጋኛል፣ ያስለኛል።
መቼ ነው የጀመረው?
2 ወር ነው ያስታክታ ያለ አዲስ ዘመን ተደረገ አላገኘሁም።
He has also coughing and then he has a lot of burning inside. He can't.
Are they related?
No. Because we are trying just to get them in. The worst one. So I came before the clinic, but they said it is beyond our ability, so we couldn't find anything. So he's hoping maybe today we can help him.
Can we get her in soon?
Yeah, that's what we have to do it now. That is the one is really the.
And him too, with his eyes can't see.
This is a Muslim, by the way. So we treat everyone. It's not really so.
Right.
ምንድነው የሆነው? መቼ ነው የጀመረው? መቼ ነው? እና ምን አይበሉም አይጠጡም? Okay. When I eat something, my stomach is coming up, and it's a lot of. I can't see my eyes also. Day by day, my eyes is coming black, dark and dark. And my stomach, I can't eat. If I eat, the stomach is up, yeah. And so, please help me say that. So. No, she says that the last 5 months, I can't talk that much. And then I can't breathe. And especially at night, I can't breathe. In the morning, I can't breathe.
She's holding her breast.
Yeah, my breast. Starting from my breast, there's a lot of pain. So maybe it's cancer. So we will do our best to maybe to take them this fall, and then see if Dr. Pastor Rick what he suggests. It's burning, says that it's burning my.
ከዚህ ሰው ጋጋቴ ሳይሆን ይቀር
This man, has 2 children. ሁለት ልጆች ነው ያሉ?
አዎ። አሁን ሶስተኛው ወልዳለ ያውን ትላንት ላይ።
Oh, his wife actually delivered yesterday another baby, and that is why he brought this baby 6-hour walking, holding this baby because he has a lot of fever and also a lot of pain. And you see here also some of the things starting, some new things. So he's really, we don't know what to do. The last 2-3 months he's struggling with the baby.
How long has the baby been sick?
ስንት ጊዜ ነው ከታመመ ልጁ?
እየተመላለሰበት ብዙ ቀን ነው የሚያመው።
ስንት ጊዜ ሆነዋል?
ወደ 4 ጊዜ ሊሆን
እኮ 4 ጊዜ ስንት ወር ይሆነዋል ከተጀመረው?
አምናም ጀምሮታል።
Oh, it's since last year.
Last year.
Yeah. So it's really very struggling. ይሄም ምን ይሰጠኝ?
የልጅቱ ነው ሪፈር የተጣጣለ
እኮ ያዘውና አሁን አይደለም የምትሰጠኝ።
ሰላም ናችሁ ወይ?
I know many of you are from the neighboring villages.
ብዙዎቻችሁ ከጎረቤት አካባቢ ከጎረቤት ገጠር እንደመጣችሁ አውቃለሁ።
You are waiting to see the doctor. Have you seen the doctor already?
ዶክተር አላያችሁም? ልታዩ ነው አይደል? አሁን ለመግባት ነው አይደል የተዘጋጃችሁት?
I want to hear from you.
አላየናቸውም. We are going to get inside the doctor.
Oh, okay, very soon. Okay. I want to know before I speak anything. Is there anything you want me to talk about? Because you are here today because of the sickness, because of your infirmity, diseases you are suffering from. Is there anything in your heart that you really want me to talk about?
እኔ ከመናገሬ በፊት እናንተ እንድነግራችሁ የምትፈልጉት ነገር አለ።
Put your hand up and
ምንድነው መስማት የምትፈልጉት ከኔ? እጃችሁን አውጥታችሁ ልትጠይቁ ትችላላችሁ። እኔን ስታዩ ምንድነው መስማት የምትፈልጉት ከኔ? አንዳችሁ እጃችሁን አውጥታችሁ መናገር ትችላላችሁ። ምን? We are sick.
Oh, you are sick. Okay. Can you tell me why you are sick?
Anybody? Lelas. Asam.
ጥጥ የሌለው ሁሉ ስንበላ የማይስማማ ዝም ብሎ አይናችን ብሎ ቢዝ ብሏል።
What did she say?
The people say that we are patients. Everybody is patient with different kind of diseases. With the eye, with the stomach.
The stomach, okay.
Different kind of diseases.
Okay, let me also tell you why you are sick. Let me tell you the reason. Okay, it is good to see the doctor. It is good to see the doctor to give you medication. But you know what? When you take the medication, after a few days, 2 weeks, you'll be fine. But you find yourself that in 3 months, you are sick again. Do you ever ask yourself, why am I sick?
መጀመሪያ ዶክተር ስታዩ ከ2 ቀን ከ3 ቀን በኋላ መድኃኒት ሲሰጣችሁ ትድናላችሁ። ከዛ በኋላ ግን መድኃኒቱን ታቋርጣላችሁና እንደገና በሽታው ይመለስባችኋል ከ3 ወር በኋላ። ሐኪም ጋር መምጣት ጥሩ ነው፣ ግን ራሳችሁ ለምንድነው የምታመመው ብላችሁ ጠይቃችሁ ታውቃላችሁ ወይ? እንደገና በሽታው ሲመለስባችሁ ለምን እንደሚመለስባችሁ ታውቃላችሁ ወይ?
ያው የለመደው ነው የደካይናው ነው። ገንዘብ ደግሞ ያያጣለን ለገድላለን ዛሬ እንላለን ገንዘብ እናጣለን። አዚያ ማከ ችግር ወጣለን ገንዘብ ስናል ገበያዶ በላይ ነው።
It's because of the money and the medicine adapts the disease. When we take the medicine, it already adapts the disease. And sometimes we cannot even afford to come to the hospital.
Okay. Let me tell you something. You are suffering from the diseases. Do you know where diseases come from?
በሽታ ከየት እንደሚመጣ ታውቃላችሁ ወይ?
From the environment.
ከአካባቢያችን
She's the only one talking. What did she say? Please let me know. What did she say? What did she say?
I asked her, do you know where the disease is coming from?
Yeah.
And she replied that if you know the place where it comes, we will kill him.
It's from your environment, your surroundings.
በሽታ ሊመጣ የሚችለው ከአካባቢያችሁ ነው። ከንጽህና አጠባበቅ ከአካባቢያችሁ ከምትበሉት ነገር
It's from the air,
ከአየራችሁ
from the water that you drink,
ከምትጠጡት
from the water
ከውሃ
that you drink,
ከምትጠጡት ውሃ
and from poor environmental sanitation. If your
አካባቢያችሁ ካለመጠበቅ ንጽህናችሁን ካለመጠበቅ ነው የሚመጣው።
From the insect,
ከኢንሴክት ለምሳሌ ከአይጥ ከተለያዩ ነፍሳት
from flies,
ከሚበሩ ነገሮች ሊመጣ
they are in the water, that muddy water that people wade in. You have bacteria in the water.
አንዳንዴ ደግሞ ካልተፈላ ውሃ ዝም ብላችሁ ከወንዝ ምናምን ቀርታችሁ ስትጠጡ እሱም በሽታ ሊያመጣ ይችላል።
Let's take an example. Malaria.
አንድ ምሳሌ ልስጣችሁ።
Malaria.
ለምሳሌ ወባ
Do they know what malaria is? Of course. You know, children, many of us suffer from malaria a lot.
ብዙዎቻችን በወባ ህጻናቶች፣ ሴቶች ይታመማሉ። But now she's saying that the malaria is getting cured now from time to time.
Yeah, but but it's coming back because because of your environment. You know, yeah. If your environment is not clean, if you have broken bottles, broken pots, collecting water around you, then they will breed mosquitoes.
አንዳንድ ውሃ ሲጠራቀም ሲሰበር ደግሞ ጋኖቻችሁ እንደዚህ ዝም ብሎ ምንጭ ኩሬ ምናምን ሲኖር ሞስኪቶ ወይም ወባን የምታመጣዋን ነፍሳት ሊያራባት ይችላል።
And you make sure, did they understand that? Yeah.
ታውቃላችሁ ወባ እንደሚራባው ረግረግ አካባቢ ነው የሚመጣው። ውሃ ደግሞ ሲቋጥ ኩሬ ነገር ሲኖር እንደዚህ ነው።
And it is very important that in your little houses, this woman is
the problem is not about malaria. We know about malaria and we are just curing from malaria. But the problem is another disease, that the stomach, your eyes.
I'm coming there. I'm starting from malaria.
ወደዛ ልትመጣ ነው። ከማላሪያ ከወባ ጀምራ ነው እንጂ ሌሎቹንም ትነግራቸዋለች።
Okay. You see some of this insects, it's because, for instance, when you have grasses growing around you, they attract the bacteria. They are insects that carry the bacteria.
አንዳንዴ ደግሞ ሳርም ሲበቅል ዙሪያችሁ መንደራችሁ አካባቢ የተለያዩ ነፍሳትን ይስባል። እሱ ወባን ብቻ ሳይሆን የተለያዩ በሽታን ሊያመጡ የሚችሉ ነፍሳትን ሊያመጣባችሁ ይችላል።
Okay. And then of course, the food that you eat, if you leave it exposed to the air, you know, flies come in. And you know, and if your food is exposed to the air, of course when you eat it, you will have stomach ache.
የሆድ በሽታም የሚመጣው አንዳንዴ እንደዚህ አይነት ምክንያት ነው። ምግባችሁን ሳትከድኑ ንጽህናውን ሳትጠብቁ ከሳር ላይ ከሽንት ቤት ላይ ከተለያየ ቦታ በሽታ የሚያስተላልፉ ነፍሳት የምትበሉት ምግብ ላይ ሊያርፍና በሽታ ሊያስተላልፍ ይችላል። ይሄም ሆዳችሁ ከሚታመምበት ምክንያት አንዱ ነው።
The most important one why you are having belly ache, you have cholera, you have typhoid, you have dysentery, is from water.
ውሃ ነው።
From water. The water you drink.
This man is from the village. Yesterday we saw him, he has HIV. And also he transferred that to his wife. ሚስት መጣለች። እሷን ማየት አምጣ ጥራት so what is this?
Is that dicloxin ampicillin?
Diclofenac.
Diclofenac.
Diclofenac,
okay.
Diclofenac injection and ampicillin.
And ampicillin, okay.
Okay, so how many do you know?
Bring his wife. She's right there.
That's his wife. I think I want to double check also her situation. Yeah, actually, I'm Michelle.
Not here.
Sit down.
Well, the medicine is good now. The medicine is very good, but you have to be on a program, regimented, and see somebody regularly.
Okay.
It's not possible, is it?
Okay. So, what do you want to ask them?
What brings them here? What are we
Okay,
doing የሚያደርግ ምንድን ነው? በሽታ ውስጥ What is this? Still can you check her? What's he trying to show me?
Oh, here he is.
Right here? What's he describing?
ምንድን ነው የሚያደርግሽ? እሱ ላይ ምንድን ነው የሚያደርገው? ያ she has a lot of ምንድን ነው ውጋት?
Stabbing pain.
አንተ ዶክተሩ አለ።
Okay, if she can open up again here. The pain is right here. There? There. She has costochondritis. That's a muscular pain. It's not her heart.
Okay.
Yeah. So she can. Does she have? Is her stomach okay?
እስኪ ሆድሽ ላይ ችግር አለ? ተቅማጥና የሆድ ህመም
እንዴት ነው ሆድ ማቃጠል? ምግብ አላስበላ ይላል። ጨጓራ ደግሞ ወደ መሰራጨት shows of dyspeptic symptoms as well.
Okay, all right. Does you have pain? Right here, huh? Right there?
Yeah.
Okay, all right. All right, so we can give her some ibuprofen. She can take, you're gonna give her this?
Yeah.
You give her this?
Yeah.
2 pills in the morning, 2 at night.
Okay.
And then
400
milligram BID. You can give her some of this. And she's going to have to take
7 days?
10 days. 10 days. And she's going to have to take a Meprazole with it.
Okay.
Yeah, you can give her a Meprazole.
Before omeprazole, then
A Meprazole BID, ibuprofen BID.
Equally?
Yes, same time.
Lots of water.
I'd like to say that, but it's easy enough for us to say. We don't know how much water they have.
They don't get much.
That's what I thought, yeah.
ኮለለች
The medicine that he would need, and she of course as well, is very expensive, but there is programs that pay for it. Especially in underserved areas, there's programs that pay for it. She would need to get hooked up with that, and also she would need to get serial or repeated labs to make sure her CD4 count is going down as a result, as well as something called her viral load. And all that has to be followed by an infectious disease doctor at a number of increments. And then once they get her on the regimen that puts those levels within normal range for an HIV patient, they can basically just stay on the medicine and actually do quite well.
What would you say his condition right now? I mean, how serious is it? And can you give us an assessment of what we expect from him?
Without labs, it's very tough to tell. He looks quite thin, he's a little gaunt. I don't know if he's always that way, I would assume not. So I would say he's a little bit progressed, but I'm just giving you just a total ballpark on no basis of just meeting him for the first time.
Right.
Yeah.
We've seen him in the village, we filmed him in the village, we know that the condition of the village is pretty deteriorated. So how would he be treated, even just to manage that?
Supportive care, lots of clean water, fresh fruits and vegetables would be very important. He has to stay away from the meat. I know they don't feel like they eat unless they have meat, but he needs the vitamins from the fruits and vegetables and water, and I think that would probably be the most helpful for him with considering what's available.
We visited this family in their house.
Yeah, I think you were telling me about
And
that.
it was moving to learn that the only thing on his mind was his 3 children. Who's going to take care of those 3 children? Because he and his wife both have HIV. And it was heartbreaking to hear him explain that he doesn't care about himself, it's his 3 children. And that's got to be our concern.